The most important thing. What do you think is the most important thing to prevent hospital-acquired infections?
Wash your hands.
Exactly. Okay, that is the bottom line. If we could get healthcare workers to wash their hands between patients, I wouldn't be up here talking about this. Because we know right now that in every healthcare setting across the U.S., hand hygiene between patients occurs less than 50% of the time. Less than 50% of the time. And that needle hasn't moved at all. Okay, and I can tell you one of the things that I've done in the past is we had a large database where hospitals would send us information on how much soap and sanitizer they were using. And we would then, through a mathematical model, find out what their actual hand hygiene compliance rate was when there was a patient in the bed. And I can tell you, we had hospitals, we have 2,000 to 3,000 hospitals in our program, and we found out basically that when people started sending us data in the beginning, it was around 30%. Now, if you go into a hospital and you ask them, what's your hand hygiene compliance rate? Some of them will look at you and say 90%. And I always say, if a hospital has 90% compliance to hand hygiene, they should not have any infections. It's just the reality of the germ theory. You know, if we have 90% of the healthcare workers washing their hands, we wouldn't have infections. Now, where do they get this number? They'll tell you, we observe our healthcare workers. Okay, now I've been in this business a long time. Think about it. I'm going to be the person who's collecting this data, so I'm going to go to the nursing location and I'm going to sit there and I'm going to look. Okay, first of all, they're going to know who you are. Secondly, when the person goes in the room, can you really see what's going on? No. So then people came up with the idea, well, if a person's in a room a certain amount of time, then they were probably doing something, so they probably washed their hands or they didn't wash their hands. So we have all this, you know, information that we're trying to gather by observing people on what they're doing in a healthcare setting. It doesn't work. So then people came out with the brilliant idea, let's hire people that we call secret shoppers, you know, like in the restaurant. So they hire these people, secret observers, and they go on the nurse's floor and they kind of like observe what's going on, and no one's supposed to, I can never figure out what security is going on, that they don't, person is a secret, and no one's turning them in. And I can tell you firsthand, our daughter, when she graduated from Penn early, she worked 6 months in one of the local hospitals here, I won't mention the name, and they told her her job was she had to hire a secret shopper, and that she had to oversee him and teach him, it turned to be him, about observing people and how he should have this clipboard, and if they went in and he saw them wash their hands, put a check. I mean, this is really primitive when you think about it. So they said, here's the person that we hired. He used to be a parking lot attendant in the hospital, so I guess they thought there was some connection. And he was he was really excited that he had been promoted. So he was a tall Jamaican gentleman. So the first day, he gets all dressed up with a suit and a tie, and she taught him how to do this. And he goes on the nurse's station, and she said, now this is what you have to do. Well, fortunately, in this hospital, she got called down to security because they noticed that what was he doing with a clipboard and a suit, and then he didn't know what he was doing. He said, I'm just supposed to watch people going in a room. Had no idea what was going on. So the bottom line is, at least in that hospital setting, they recognized a secret shopper, but how valid is that data? So when hospitals tell me they have 90% compliance and they're observing their healthcare worker, it just isn't true. Okay. So what is the solution? You need to be the observer. And that's when I, 15 years ago, came out with a program called Partners in Care. And my colleague said to me, it'll never work. And for 15 years, I said, it will work. And I think I got funding from every soap company that there is to do my research, because when you're at Penn, you know, if you're going to do your research, you have to bring in your own money. So I did these studies, Partner in Your Care, where we basically, when a patient came into the hospital, we said to them, look, you know, our hospital does a good job in trying to prevent you from getting infections. And what we'd like you to do is be our reminder. When a healthcare worker comes into the setting, you just say to them, can you please wash your hands, or thank you for washing your hands. And what we found out, we did our first study over in New Jersey, which is now the virtual health system, and we did it in 4 hospitals over there. And we found out within 6 weeks, they were able to increase their hand hygiene compliance by at least 34%. Now that may not seem like a lot, but when we started with this group, they were around 10 and 15%. So in 6 weeks, they were able to get their compliance up to the point where the healthcare workers often then after a few weeks would go into the patient and say, isn't there something that you'd like to ask me? And I think that's important. You want to change behavior. That's what we're talking about. So for 15 years, I did various studies. We did the same study. I had a sabbatical in Oxford, and we did a study over there. And guess what? They said to me, if it works over there where they have socialized medicine, where people wait 18 months to get into a hospital, it'll work anywhere. Well, guess what? They were more willing to ask than the U.S. patients. We did this in rehab medicine, an entire rehab unit, because if you're dependent on your healthcare worker for your daily activities of living, are you going to rock the boat and say to them, hey, would you like to wash your hands? We found that it worked there. And people said to me, they always put tumbling blocks in front of me, like, well, how about the intensive care unit where patients can't work? Fortunately, I'm very creative. And I said, well, no problem at all. What we did was put speakers on the wall in the intensive care unit. And basically, we had the doc and the nurses record messages like, don't forget to wash your hands between patients, don't forget to use sanitizer. That played between 6 a.m. and 10 p.m. at the nurses' station. And we told the healthcare workers, if this bothers you, you could shut it off. Guess what? No one shut it off. And why didn't they shut it off? Because who was going to shut off the voice of their boss, who was the medical director? No one. So they constantly heard this playing. The visitors heard it. And in this particular hospital, and it was a hospital actually on the main line, and it was published, so I'll say it was Bryn Mawr Hospital, they increased their hand hygiene compliance over 100%. In that intensive care unit, just by being reminded to do these things. So finally, after all these studies, the Joint Commission, I always say the Joint Commission, it took them several years to do what I did earlier, is they came out for guidelines that you must engage your patients to be part of your care. The World Health Organization actually has a chapter in which I was the lead author, and I wrote on patient empowerment, that it's important. And there's more and more. There's things coming out every day from our government that you need to engage your patients. It has to be a hospital's responsibility to make them part of the team.